Hello everybody, this is Dr. Kevin Connors again talking about Module 2 in the Stop Fighting Cancer course. In this module, I'm going to give you a brief overview of our Connors method. And understand, there's a lot of information in this. I'm really shrinking it down. Please make sure you download a free copy of my Stop Fighting Cancer and Start Treating the Cause book, because that can be a wealth of information for you as well. Plus, I have several other books that you'll want to download and look at as you go through these modules. Just a reminder for you. The detoxification book will be extremely helpful when you start getting into some of our methods, our pillars that we're talking about here. And then dealing with that spiritual side and that emotional side is such a key when you're dealing with a serious disease. You don't want to ignore that. So let's go over what I have labeled a number of years ago when I first started treating cancer back in the late 1990s. Boy, it seems like a long time ago. In the early 2000s, I came up with what I called the 4 pillars. Now, there's a lot in each one of these pillars, so we could expand it to be the 24 pillars, but I'm trying to keep this simple in understanding these pieces, because I do believe that when you're dealing with a serious disease, you already got enough going through your head that you don't need to be confused. We got to keep this simple. So, and our approach is simple. And some people have complained that it's too simple. But if you don't keep it simple, people don't stay on things and people don't stick with things. And then, well, what good is that? And then they don't have results at all. So you have to keep it simple and easy to do and as least disruptive in a person's lifestyle. Or no matter how motivated you are to start, we're going to juice 12 glasses of juice a day, and we're going to, go on a complete ketogenic diet, and we're going to do all this stuff. It becomes so life disrupting that isn't good for us in a lot of ways. We can actually make an idol out of treating our cancer or our disease, and then that becomes very spiritual, a big spiritual issue. Or we could make it so complicated that we can't stick with it. And we can have that motivation for a period of time, and then it weans and wanes quickly. And after a couple of weeks, we're so exhausted from trying to treat our cancer or treat our disease that we're sick from that. And, dealing with myself personally and dealing with patients, back as the last 20 some years, it's the easier that you can make it and the least life disrupting that you can make it, the better results we get. Which seems kind of ironic. Shouldn't we be taking 47 different bottles of supplements and 3 of them 3 times a day, making 150 supplements a day, and have to follow this diet and do all these procedures and go to these clinics and get IVs and do all this in order to get better because I'm really sick? Well, there's truth that we do need to do some things. There is a work on our part if we're going to get better from being sick. We do have to change lifestyle things. But the least disruptive you can make it, the better it's going to be, because you'll stick to it. It doesn't have to be a grandiose change to make a big difference. And that's the key. It doesn't have to be a grandiose change to make a big difference. A lot of people, especially men, are really happy to hear that because men got a lot of things on their mind already. Not that women don't, but they tend to be less focused on their body and, being able to stick to a diet. Maybe it's just our makeup. I don't know what it is. Women tend to be much better disciplined at those things. But we want to keep this a very doable procedure. So as we go through these 4 pillars, I'm going to give an overview in this module, and then in the following modules, we're going to dig deep into each one of these things. Our first pillar is to address the cause. We talked about that already. My book is titled that. Stop Fighting Cancer and Start Treating the Cause. And I titled it that way because that was my philosophy from the very beginning with my first cancer patient. We're not going to have this fight. I don't think that's healthy if we're fighting something in our body. And I understand. I've seen these blank cancer bumper stickers out there, and people can get very emotional when they're dealing with a serious disease that could kill them, and they can get angry, and they can become bitter, and they can have these emotions, and I realize that can be healthy to go through those, but we have to go through them. We have to come out at the other end and take a more pragmatic position in that, okay, now what am I going to do about this? Fighting and being angry at our cancer, I don't think solves the problem. I think we need to take a step back and look at it. There are causes to cancer. Remember, cancer is something got inside of a cell, one cell, and interrupted the cellular replication in the nucleus of that cell, and now that cell is replicating uncontrollably, dividing and dividing and dividing, replicating at a much greater rate than what is normal. Normally, most cells will divide, will replicate, and then the mother cells eventually die off through a process called apoptosis, normal programmed cell death, which is basically a recycling of that cell matter to be used throughout the body. But when that doesn't happen, and a cell goes into rapid replication mode because of something that got inside of that cell, then we're in trouble. So we do want to address that cause. What was it that got inside that cell? Was it a biotoxin? Was it a virus? Was it a bacteria? Was it a pesticide, an herbicide? What is tied to that also, the pieces of cause? Is it driven by hormones? Is it driven by a bad environment? We want to address those pieces. It's funny that medicine is very good at looking at causes of cancer when they do all these studies on, well, this causes cancer, and this causes cancer, and you know, hardly a week goes by without you seeing another cause of cancer. But then how come when somebody gets cancer, that is never addressed? Never have I had anybody come to me that says, hey, I found out I have cancer and it's because of a pesticide. They don't look for that, even though, hey, pesticides are probably the number one cause of lymphomas and leukemias, but never had a lymphoma patient come and tell me that. So we want to look for that. There's ways to test for that, and we'll talk about that in the next module, actually. And then we want to address the cancer itself. That's pillar number 2. We do need to find a nutraceutical, from our perspective, an herbal or a homeopathic protocol that's going to be best suited for that person's body to stimulate the immune system to kill the cancer. We want to address the cancer, not just taking care of the cause, but we have to address the cancer. And we have to do it in a way that we're not using a ton of stuff, in the least amount of things possible. Again, keeping it simple, keeping it doable, keeping it that you can continue to do this on a regular basis when the motivation starts to wane. And then we want to use technology. We use Rife technology, we use PEMF technology, we use hyperthermia, hyperbaric. There's technology out there that can help the body, the immune system, attack the cancer. To me, Rife technology is the best as far as getting the body to focus on that cancer. Part of the reason why your immune system doesn't kill the cancer is that the cancer cell is still self-tissue. It's still your own cells, and your immune system is programmed to not kill self-tissue. So you've got to get the immune system, the T cells, the macrophages, the natural killer cells, to be able to attack that cancer that's growing out of control. that rapid replication of cells. And you do that with hitting it with its own frequencies. You're causing it to vibrate. You're causing the immune system to refocus on that and look at that again and go, oh my gosh, what is that? Maybe we need to take a second look. Maybe we need to kill that rapidly growing mass. So we do Rife programming specific to that cancer so that person's body can best help kill the cancer. And personally, I believe using Rife helps immune products, nutraceuticals and things help target the cancer, and even chemotherapy and immunotherapy, it helps it target the cancer. So that's my personal opinion. I have no research to prove that, but we've seen that in our practice. So I think Rife is invaluable. I don't think I'd be standing here talking to you right now if I didn't use a Rife machine. So I think a Rife machine is invaluable. And you need one that's going to be able to penetrate the body and be easiest to use. And we'll go into that in detail in coming modules as well. And then lastly, you need to clean up the terrain. We talked about this in the last module, gave a really neat picture of a fish in a dirty tank and a fish in a clean tank. Real easy picture to understand that your terrain, your environment is super important. That environment where that cancer is growing needs to be cleaned. That's the process of detoxification. That's the process of just natural healing. Lots of talk about pH balance, but cancer is growing in a rapid state, causing an acidic environment at that cancer. So we need to detoxify and clean that area out. So those are the 4 pillars that we're going to dive into in these modules. Stick with me here. Download my book. As I said, download my detoxification book and my Cancer Can't Kill You If You're Already Dead book. Start dealing with the emotional, spiritual side. Start dealing with the understanding detoxification and the 7 phases of detoxification, how important that is. Those things, you start doing these things, no matter if you're choosing standards of care along with this or not, will help you tremendously. All right, I just pray that this is a blessing to all of you, and we'll see you at the next module.